Medical memory is a patient communication platform that allows providers, nurses, and hospitals to better educate patients and their family members during COVID-19. It's a simple communication app that is available on any iPhone or Android device. As hospitals are restricting access to family members, they are craving information to get vital health updates about their patients and loved ones that are in the hospital, either recovering from COVID or other, health concerns. What medical memory is doing is it's providing an easy HIPAA-compliant video messaging tool to keep the remote family connected about the information for that patient. This is a great example of how this is being utilized throughout hospitals. Providers do a great job communicating effectively to their patients. They share their vitals, they share the concerns, they share updates to where they are in their recovery. Let's record that conversation and allow the continuum of care who aren't able to be sitting in that hospital room with that patient due to COVID-19 all have that same update. Patients are thrilled because family members are understanding what's happening. They're being all given the exact same messages. Providers are thrilled because they're not having to make call after call after call after call to update the entire family member on this care. Nurses are the ones that are really leading this charge. They're the ones that are grabbing their phone, putting in the patient information, recording the doctor, giving their rounds or their vitals for these patients. That being said, everybody is updated with the exact same information about that patient's care, and all are educated about where this patient is in their recovery and what potential steps are going to be needed once they return home. A 2-minute message and everybody's informed. Medical memory is making nurses and providers more efficient and more effective. Doctors can give a 60-second video update to tell family members and patients about their care. Not only does this build a greater trust equity between the patient and the provider, but it also extends that to family members who may be concerned and unable to meet that provider. The doctors are able to round on their own schedule, whether it be early in the morning or late at night. They're not having to schedule specific times to connect with family members, yet record their vital message about that patient's medical update or that patient's care and have that message sent to everyone in that care team. It minimizes phone tag and callbacks to patients' family members, allowing everyone to have that same message. Medical memory is a secure solution that is scalable fast. Any nurse, doctor, provider can download medical memory on an iPhone, iPad, Android device and start utilizing it right away. This makes the ability for us to scale into a hospital super convenient and super fast. It is HIPAA compliant and follows all the requirements under HIPAA. The videos themselves have a 256-bit encryption and are not actually stored on the device. Once the videos are recorded, they're uploaded off of the device onto the cloud, and that patient gets an email that they're able to then access those videos. They can also then send those videos to family members, friends, continuum of care, or even set up a medical power of attorney that can control that video content for them. Our app is being used across top hospitals in the country where we've been vetted through secure systems to ensure that we're covering all requirements for major hospitals. Medical memory is a solution beyond telehealth. Unlike telehealth, this is a one-way video message that allows providers to give quick, efficient updates focused on the medicine and allow that to be communicated effectively to a patient and their continuum of care. All family members are updated, whether they're out of town or even not able to come due to hospital restrictions. You can also update family when the patient's non-responsive or a NICU baby. The difference between telehealth is that it's a back and forth conversation. The challenge with that is it's unbelievably time consuming. You're not able to record this and have this message be reviewed by multiple people. It's not available when a patient is in NICU or unresponsive, and it can be incredibly time consuming for the clinician. We're utilized throughout the hospital. One of the biggest spaces that we were used before COVID is in discharge. And I think that's one of the spaces that's incredibly valuable even after, COVID, is looking at discharging patients and giving them these video instructions that nurses already do so great educating patients, but giving them that in video, just doing the same instructions, but just on video. So that way a patient can review that information when they're off pain medicine, the family member can review that information, and everybody is on the same page to help prevent readmissions back in the hospital on something that easily could have been informed with a doctor giving that video. Doctors are really starting to use it in rounding with patients where they are able to give these updates now that restrictions are closed. Now everybody has that same update. When we do have unresponsive patients, ICU patients, NICU patients, where holding a phone and FaceTiming with the provider is not something that is available, providers can continually, or nurses can continually send these one-way messages to the family members to update them about the care that when they can't be with that loved one. And I think all of these ways are incredibly powerful usages of this tool, and in a way that makes it easy for nurses to be excited about using it and to keep pushing forward in patient communication. And it's so easy to get started. Download the app in 30 seconds, and in 3 steps, you can enroll your patients, start recording, and get everyone in their continuum of care the same update about that patient. With hospitals closing access to guests, it's becoming harder and harder to keep families informed. Medical Memory wants to support patient communication during this trying time with our Record app. It allows providers and nurses to efficiently update all family members with one HIPAA-compliant video message, as opposed to making several follow-up phone calls to provide the very same update. The first time a provider records with the patient, they're going to go into the record workflow. Let me show you that now. You're going to click the record icon in the upper left-hand corner. Now we're going to put in our patient name and their date of birth. Click Continue. If your patient has already enrolled with Medical Memory, you're going to see their first name and email address listed as one of these accounts. If it's a brand new patient, go ahead and click New Patient at the very bottom left. I'm going to choose my patient. You'll see that the first name and email pre-populates for you, but now you have a blank called Medical Power of Attorney. You can use this in one of 2 ways. If the patient is unresponsive and not able to send information to family members, you can put a medical power of attorney, friend, family, as in this as an option. Put in their first name, last name, and email address, and they will receive all messages that you would send to this patient. You don't have to have a patient that's unresponsive. You can also have a patient say, hey, I'd also like all of these videos forwarded to this person, and fill in their information as well. So this is an optional field, so you can fill that out or you can just continue, but you will choose St. Joe's Hospital as the provider at the very bottom. Next, click Record. It does say return the device to a staff member. If you're the one holding the device, just press OK. Now, we are ready to record. We have a few options. We have the record screen, which is in like selfie mode. So you can click record at any point, and then you can also pause it as you're going through your message with your patient. You can also flip to front and back camera. So you're able to then see, if you're wanting to show them scans or anything along those lines, you can do that as well. So flip to front or back. Some providers will do a highlight reel where they'll pause and restart it throughout their messages, or just leave it recording the whole time. When you're done, click save in the bottom left-hand corner, and then you're going to click send to send it to that patient. The video now is off of the device and is onto the cloud. The patient will have received an email to be able to access their video. If you have any questions about that video being uploaded, you can click this cloud in the upper right-hand corner and see that the video has been uploaded. If for any reason you see any of these dots as yellow or red, just press and hold, and it'll refresh the video to start recording again. Now we're ready to start with our next patient. If you have any questions at any time, you can always go to the home screen, click on this red question mark, and then you're taken to our help landing page. With this, you can fill in your first name, last name, email address, how we can best contact you so that we can reach out if you do have any questions. Also at the very bottom are videos for how to use each of the medical memory tools. Thank you so much for taking great care of your patients. Once you record a video, it's off the phone, onto the cloud, and then a patient or their family member that they might have set up receives an email to be able to access it. There is a patient app where patients can also download the tool and be able to review the videos right there on their phone or set up their sharing right there on their phone. But it makes it really, really easy for patients to be able to access it, keep all of their videos all on the same platform, so that even if they are faced with things down the road, they can always have this as a reference to revisit and relook at. And our doctors are loving the benefits of medical memory. They're talking about the impact on families, and how this medium is allowing a continued conversation that's really effective. Everybody's getting the same message. Let me show you a video from Dr. Tannehill, a radiation oncologist, and how it's really impacting families.
So right now the family dynamic has been improved greatly. I don't see the family member. I don't even know that they exist necessarily, but we've already calmed the waters in that family situation because everybody has access to that visit, and everyone all over the country now can relax and understand exactly what's being said. And when those people call me, they don't need much time on the phone to understand something because they've just watched the hour-long consult. So it saves us a ton of time in the clinic. The callbacks, the confusion, have been dramatically reduced by the use of this technology.
Here's a video from Dr. Uribe, a neurosurgeon for Barrow Brain and Spine, really saying, hey, try it, use it. You'll see how effective it is and how much it's going to improve the time in your day-to-day.
I will challenge any healthcare provider to use it. I'm sure that once you use it and you have the experience of the full medical memory, I'm sure that you will never say no to this great tool.
Hear from Dr. Porter, who created this tool because he was having challenges understanding the health concerns of his father in a different state as he was trying to be a son and a neurosurgeon and a support system for him, and saying, hey, there's got to be a better way for me to understand the vital, important information about my dad right now. And that's why he even created the tool. Hear from him as some of the benefits.
When my father went to the doctor, and I even flew out for a few visits, I realized that it was very time inefficient for me to fly to Chicago just for a visit to help remember what the doctor said. So it occurred to me that some sort of a recording device would help the situation. I was afraid to ask his physicians to record, but then when I came back to my own practice and I looked my patients in the eye and I told them I was going to open their skull or open their spine, even the most intelligent people would come back 2 weeks later and say, I don't remember anything you told me. And that's understandable. Patients forget what we tell them as physicians because it's an emotionally charged discussion, because we're rushed, because we use complex medical terminology, because of normal memory fade, because they're 80 years old. They don't hear well, they don't see well. Sometimes because they're intimidated by also known as the white coat syndrome. So we have a problem, and every physician in America knows that patients don't recall. And giving them an opportunity to securely rewatch what the doctor said as many times as they like, and securely through a HIPAA cloud environment share with friends and family anywhere in the world with an internet connection, provides a great opportunity for the patient to re-review, but the family members as well. And the family members can really play an important part in helping the patient understand, helping the patient decide on what treatment they would like, and helping the patient comply.
And our providers are loving the tool. Dr. Tannehill from Arizona Center for Cancer Care is saying, the family dynamic is improved greatly. Everyone has access to that visit, and everybody all over the country can understand exactly what's being said. Callbacks and confusions have been greatly reduced by the use of this technology. And I think that's one of the things. Not only are patients better connected, family members better understanding the information, but doctors are saving time. They're not spending a ton of time on callbacks and playing the game of telephone. Virginia Pendergast, who really scaled this throughout Dignity Hospital with all of the nurses there, is saying, it ensures patients and their loved ones are hearing the same message no matter where they are in the world. And I think that is incredibly key. Doctors are doing a great job communicating to patients. Let's take a minute, record them doing that, and have that be sent to those that can't be sitting in the room with that patient to ensure that information is being told. And Dr. Uribe, try it. try it. You'll see it's such a great tool once you utilize it and really have that experience. And what's amazing is we're hearing incredible impacts from the nurses. Nurses are telling us that family members are just so touched of having this resource for their patient that's in the hospital. Thank you for the updates. Thank you for the videos. Sometimes we watch them time and time again. It's our way of, seeing them and when we miss them. We had one nurse was talking about how there was a baby in the NICU and that she was able to provide updates, 3-4 times a day, and that the family members would just watch and watch and watch these videos, at times when they weren't understanding or feeling scared about their baby, and they would have these vital updates. They looked forward to those videos. So that's one of the amazing things is nurses are leading this charge, and they're the ones telling us these stories of the impact of this tool in strengthening this patient communication platform.
Okay, go.
Hi, I'm Belen. I'm from St. Joseph's. I am from the medical memory team. Has been a great experience for me and very rewarding. First video that I did was a patient that was a post-cabbage. Family hadn't seen him since the surgery. The nurse recorded the video. Patient was up in the chair working with physical therapy. And she just updated the family that, we're going to send him to a regular floor. Going to get rid of some of these chest tubes. And if you have any questions, just give her a call. So we've had many opportunities like that, and seeing patients walk for the first time and just hearing how the family members are so blessed and thankful that they're able to see their family. So as we continue to educate everybody on the floor, as people do this, they'll realize how beneficial and how rewarding it is for them, for the patients, and it just makes a difference in our day. So thank you for the opportunity.
Hi, I am Chris. I'm part of the medical memory team here at St. Joe's, and we just wanted to share with you some of the positive experiences and the challenges that we're able to overcome during this horrible COVID situation for our families and our patients. I was able to videotape yesterday with a surgeon and patient and chaplain, the 80-year-old man who came in who had never had a chance to meet with his surgeon, terrified family at home, and the surgeon was able to do a full explanation of what the surgery was going to be, what the expectations were going to be for the patient. The chaplain was able to do a prayer. The surgeon even ended up reading a prayer that the patient had brought for him, and everything was sent to the family, and they were so excited. They could not believe how much they felt like they actually got to be a part of what this patient was going through. And they can keep that video forever, and they can just keep watching it. And they also got to see the compassion of the surgeon and the team around them that was taking care of him. And it meant a lot to everybody. Did a follow-up with him today, and the surgeon was back there again doing the same video and giving him an update. And the family is thrilled. And that's it.
Contact me and download it. We can set up your hospital. We can set you up as a provider. You can play with it. You can put in fake patients if you want and record your husband. It doesn't matter. Download it, start using it, see how easy it is. And then you'll see, hey, all it takes is 2 clicks for me to record myself giving the same information I already do. I already do a great job communicating. Now I'm just going to record myself doing it so that everybody has access to a great video and update their family members.